The boy was drowning on dry land. Each breath came shallow, wet, rattling. His lips had gone the colour of ash. The British medic who pulled back the filthy uniform jacket stopped moving. Just stopped. His hands hovered over the exposed chest, trembling slightly, and in that moment, every man in the tent understood that what they were seeing should not be possible. An 18-year-old should not still be breathing. Not with lungs like that. Not after what had been done to him. By late 1944, the war had turned. Britain no longer fought alone on the edge of annihilation. The factories that had once strained to replace lost Hurricanes and Spitfires now operated with ruthless efficiency. The Americans had arrived. The Soviets were bleeding Germany white in the east. And everywhere, from the hedgerows of Normandy to the rubble-choked streets of German cities, the Reich's armies were learning what it meant to face an empire that had survived the worst and decided to return the favour. But survival had made Britain something harder than it was before. The prisoner of war camps filling with German soldiers told a different story than the propaganda reels. These were not the master race. These were boys and old men, hungry and hollow-eyed, pulled from positions they could not hold with weapons they could barely maintain. The camps near the southern coast received them in waves, hundreds, then thousands. Farm boys from Bavaria, factory workers from the Ruhr, teenagers who had never fired a rifle until the week before their capture. Most arrived defeated. Some arrived broken. This boy arrived dying. The transport truck that delivered him to the camp did so almost by accident. He had been found in a field medical station, tucked into the corner with the ones no one expected to survive the night. A punctured lung, they said. Shrapnel from a British artillery barrage that had torn through his position 3 days prior. He should have been dead within hours. Infection. Shock. Internal. Bleeding. But he was still breathing when the camp changed hands. So they loaded him onto a truck with the others, and he became Britain's problem. The camp medical officer was a man named Captain Edwards, a surgeon from Kent who had spent 2 years in North Africa before being rotated home. He had seen everything the war could do to a human body. Burns that cooked men from the inside. Wounds so catastrophic they left nothing recognizable. He had learned to assess, to categorize, to decide in seconds who would receive morphine and who would receive a blanket over the face. But when they brought the German boy into his examination tent, Edwards did something he rarely did anymore. He hesitated. The boy's breathing was impossible. Too fast, too shallow, the kind of desperate gasping that comes when the body knows it's losing. His skin had gone grey-white, slick with fever sweat. The puncture wound in his chest was obvious, a ragged tear just below the right clavicle, crusted with dried blood and field dressing that had been applied days ago by hands that knew it would do no good. Edwards had treated punctured lungs before. He knew what they looked like in the first hours, the panic, the choking, the slow suffocation as the lung collapsed and the chest cavity filled with fluid and air. This boy had been living with it for 3 days. How? The examination began in silence. Edwards cut away the uniform, the fabric stiff with old blood and dirt. 2 orderlies held the boy still. Not that he could resist. His eyes were half closed, unfocused, rolling back periodically. Delirious. He muttered in German, fragments of sentences that made no sense. Names, perhaps. Places. Edwards pressed his stethoscope to the chest. The right lung was barely functioning. Every breath created sounds that should not exist. Wet clicking, bubbling, the unmistakable evidence of fluid where only air should be. The left lung was compensating, working frantically, but it too was beginning to fail. The boy's oxygen-starved blood was slowly poisoning his brain, his organs, everything. He should have died on the field. He should have died in the medical station. He should have died on the truck. And yet, how long has he been like this? Edwards asked the corporal who had delivered the prisoners. Don't know, sir. Found him with the others. Germans said he'd been hit during the shelling, but that was near a week ago now. A week. Edwards looked down at the boy again. 18 years old according to the makeshift papers they'd found in his pocket. 18. Born in 1926, which meant he would have been 12 when the war began. Would have spent his adolescence under rationing and air raids and propaganda that told him he was destined to rule the world. Now he was suffocating slowly in an enemy camp, kept alive by nothing but the body's stubborn refusal to understand when it had already lost. There were rules about medical treatment for prisoners of war. The Geneva Conventions were clear. Edwards knew them by heart. Enemy wounded were to receive care equivalent to what would be given to British soldiers of the same rank. In theory, this boy deserved an operating theatre, a surgical team, every chance at survival. In practice, the camp had one functional operating space and a waiting list of British soldiers who had been wounded in the latest push into Belgium. Men who had fought for Britain, who had families waiting for them, who had earned their place in that queue with blood and service. The German boy had not earned anything. He had simply failed to die on schedule. Edwards made his examination thorough, professional. He documented the extent of the injury, the lung collapsed, the pleural cavity compromised, signs of infection setting in. Without surgery, without drainage tubes and antibiotics and careful monitoring, the boy had perhaps another day, perhaps less. Even with treatment, the chances were poor. The infection had spread. The body was weakened. Resources were limited. The reasonable decision was morphine and a quiet corner. Edwards had made that decision dozens of times before. Sometimes the kindest thing a doctor could do was ease the passage, stop the suffering, accept what could not be changed. He prepared the morphine, but his hands did not move. One of the orderlies, a man named Private Hutchins, stood beside the examination table and watched the boy struggle for air. Hutchins was 24, had a wife in Manchester, had been at Dunkirk when the world was ending. He had learned to hate efficiently, to see the enemy as the enemy, nothing more. But this was not the enemy. This was a boy who looked like Hutchins' younger brother, who gasped for air the way drowning men do, who was dying slowly, terribly, in a way that had nothing to do with war or ideology or any of the grand narratives that made killing acceptable. "He's the same age as Tommy," Hutchins said quietly. Not to Edwards, to no one. Just speaking the thought aloud because it was too heavy to carry silently. Edwards knew who Tommy was. Everyone in the camp knew. Hutchins' brother had been killed at Monte Cassino 6 months earlier, blown apart by a German mortar round. There had been nothing left to send home. The morphine sat prepared in Edwards' hand. The boy continued to drown. What changed Edwards' mind was not compassion. It was not some sudden revelation about the value of human life or the brotherhood of man. Those were luxuries for peacetime, for people who had not spent years wading through the consequences of industrial-scale killing. What changed his mind was simpler than that. He was a surgeon. He had taken an oath, and the boy was still breathing. Sometimes the answer was just that mechanical, that devoid of poetry. "Prep him," Edwards said to Hutchins. "We're draining the lung." The procedure was not complex, but it was delicate. Edwards worked quickly, efficiently, cutting a small incision between the ribs and inserting a chest tube to drain the fluid and air that had collapsed the lung. The boy barely reacted, too far gone to register the pain, his body operating on pure autonomic function. The drainage began immediately. Dark fluid, infected, foul-smelling. A sign of how close to sepsis the boy had come. But beneath the infection, beneath the trauma, the lung began to reinflate, slowly, tentatively, like something that had forgotten how to work properly and was being reminded, step by agonizing step. Edwards monitored the boy's breathing, waited, watched the color return to his lips, degree by degree, watched the desperate gasping ease into something more controlled, more regular. It took 3 hours. 3 hours to pull one German boy back from the edge of death, while across the channel, British bombers were turning German cities into ash. While British soldiers were pushing through the Siegfried Line, killing boys just like this one, creating more punctured lungs and shattered bodies and fathers who would never come home. The war did not pause while Edwards operated. It did not care. It ground forward with its own terrible momentum, indifferent to individual acts of mercy or cruelty, swallowing everything in its path. But in that tent, in that moment, one boy kept breathing. The days that followed. The German boy, his name was Klaus, they discovered later, though for the first week no one asked and he could not tell them, remained in the medical ward. The infection persisted. His body, weakened by days of oxygen starvation, struggled to heal. Edwards changed his dressings twice daily, monitored the drainage, administered what antibiotics could be spared. Other prisoners arrived, more boys, more old men. The camp swelled with the refuse of a collapsing army. Some came wounded, most came defeated, faces blank with exhaustion and the knowledge that their war was over and they had lost. Klaus lay in his cot and breathed and slowly, incrementally, improved. The British soldiers who guarded the camp did not know what to make of it. They saw Edwards spending time on a German boy while British casualties waited for beds in overcrowded hospitals. Some muttered, some questioned. Most simply accepted it as one more inexplicable decision in a war full of them. Hutchins visited Klaus daily, brought him water, helped him sit up when the coughing fits came, the body still purging fluid from the damaged lung. They did not speak. Klaus knew no English, Hutchins no German, but something passed between them anyway. An acknowledgement, a recognition. They had both survived things they should not have. That created a bond that transcended language. What the examination revealed. It was not until Klaus was strong enough to speak clearly that Edwards learned the full story. It came in pieces, translated haltingly by a German-speaking officer, assembled like a puzzle made of horror. Klaus had been conscripted 6 months earlier, pulled from his apprenticeship as a mechanic in Stuttgart, and sent to the Western Front with 2 weeks of training. His unit had been positioned in northern France when the British artillery barrage came. He remembered the sound first, the screaming descent of shells, the world splitting open, then the impact, then nothing. He woke in darkness, buried under rubble, unable to breathe properly. His squad mates were dead or dying around him. He could feel the wound in his chest, could feel the wrongness in his breathing, but he could not move, could not call for help. He lay there for 6 hours before a German medical team found him. They had no supplies, no equipment. The field hospital was being evacuated as British forces advanced. They gave him a field dressing, a morphine shot, and put him in a corner to die quietly while they focused on men who might survive. But Klaus did not die. When the British overran the position, they found him still breathing, still conscious, a medical impossibility that no one had time to explain. So they put him on a truck. And now he was here, lying in a British POW camp, being kept alive by an enemy surgeon who had every reason to let him die and could not quite bring himself to do it. The examination that had shocked Edwards was not just the punctured lung. It was not just the infection or the days of survival against probability. It was the realization that they were healing a boy who would return to a Germany that no longer existed, whose family might already be dead under Allied bombs, whose future had been obliterated long before the shrapnel tore through his chest. They were saving him for nothing, and they were doing it anyway. Klaus survived. He spent 8 weeks in the medical ward before being transferred to a standard prisoner barracks. His lung healed, though he would carry a rasp in his breathing for the rest of his life. A reminder, a scar that went deeper than tissue. The war ground on for months after that. More prisoners arrived, more boys with punctured lungs and shattered limbs and eyes that had seen too much. Edwards treated them when he could, made decisions about who lived and who died, based on calculations that had nothing to do with nationality and everything to do with resources and probability. He never saw Klaus again after the transfer. Never knew what happened to him after the war ended. Whether he made it back to Stuttgart, whether there was still a Stuttgart to return to, whether his family survived. The records show only that an 18-year-old German POW with a punctured lung received medical treatment at a British camp in late 1944 and lived. One name among thousands. one survival among millions of deaths. Edwards returned to Kent after the war, opened a practice, married, had children, lived a full life. But sometimes, late at night, he would wake with the memory of that examination. The impossibility of that boy's breathing, the decision he almost made, the morphine he almost administered. And he would wonder if he had done the right thing. If there even was a right thing in a world that created punctured lungs in 18-year-old boys and called it necessity. The question never found an answer. Some things the war did not resolve. Some weights it simply distributed across the living, to be carried forward into whatever came next. Klaus breathed. Edwards wondered. And the machinery of history moved on, indifferent to both.